Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn-to-Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the Learn One, Do One, Teach One approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. By participating in the Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed and proactive health custodians who can address health challenges in a sustainable and impactful way. Join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn-to-Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the Learn One, Do One, Teach One approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. By participating in the Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed and proactive health custodians who can address health challenges in a sustainable and impactful way. Join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn-to-Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the Learn One, Do One, Teach One approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. By participating in the Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed and proactive health custodians who can address health challenges in a sustainable and impactful way. Join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn-to-Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the Learn One, Do One, Teach One approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. By participating in the Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed and proactive health custodians who can address health challenges in a sustainable and impactful way. Join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn to Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the Learn One, Do One, Teach One approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. By participating in the Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed and proactive health custodians who can address health challenges in a sustainable and impactful way. Join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn to Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the Learn One, Do One, Teach One approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. By participating in the Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed and proactive health custodians who can address health challenges in a sustainable and impactful way. Join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians.
Good evening, everyone, and welcome to today's Health Access session. So today we are privileged to have a guest speaker who is a biomedical engineer. Miss Jemima Wambui. Hello, sorry. So good evening, everyone, and welcome to today's session. I was confirming whether I wanted to text Dr. to join, but I can see has already joined. So today we are privileged to have a guest speaker who is a biomedical engineer, Ms. Jemima Wambui, who will take us through improving healthcare access through health data. So in our previous session, we tackled the health access hackathons during our Nairobi summit, which will take place from 3rd to 6th of December this year. So we usually have these sessions, the health access sessions, where we bring different different guest speakers from technology, from healthcare, from blockchain to have the conversation in line with the summit theme, which is using artificial intelligence to improve health and human development. So today, Ms. Jemima will take us through the improving healthcare access through health data. And before that, allow me to take you through the meeting agenda. We will have our first speaker, who is our topic presenter, Jemima, and then we'll have additional notes and comments from Dr. Masharia, our CEO, and then we'll have an interactive session, and then we will have summit announcement. So now allow me to welcome our topic master, Jemima. Kindly confirm whether you can hear me.
Yes, I can hear you, Glory.
The floor is yours. You can go ahead with the presentation.
Okay. Hello, everyone. My name is Jemima Wamboi Manasseh. I am a biomedical engineering student at Kenyatta University. And today I'm going to present on my project on digitizing medical records for efficient healthcare delivery for individuals. Let me share the screen. I hope you can see.
Yes, we can see. We can see your screen.
Thank you. So as I said, I'm going to present on digitizing medical records for efficient healthcare delivery for individuals. And I'm excited, I'm very passionate about this topic, and I hope you enjoy my presentation. So digitizing medical records entails converting paper-based health records into digital formats that can be stored and transmitted electronically. Since we already have paperwork, we have our hospitals, we usually use paperwork. And since we already have that, it is an advantage because now digitizing them only involve scanning the medical documents and uploading them into databases using a standardized data entry method. So our problem statement in this is basically all the disadvantages that comes with paperwork. This includes loss and damage of medical documents, such as scans. We have errors due to manual handling and transcription, and also the wastage of time and resources on keeping, maintaining, and retrieving paper documents. But the major problem that I would like to address is the lack of data analytics on personal medical data. So for the longest time, we are used to keeping medical records rather than using them. We are used to preserving them and keeping them away until the next doctor's appointment, which you may or you may not use your records. But with the emergence of Industry 4.0 technologies and the Web3 technologies, which involve decentralization, artificial intelligence, blockchain, and connectivity, we can finally use our medical data to improve our healthcare delivery. So stressing on this problem, I would like to point out on more of what we are missing out. because of using analyzed data. So we have delayed diagnosis and treatments, since it's harder for healthcare providers to detect patterns and anomalies, which when detected, it can fasten the diagnosis process. We also miss on disease prevention, since we are not able to give personalized lifestyle recommendation. And with that, we also have limited personalized medicine, which in cases like cancer treatment, where we rely heavily on the patient's response to drugs and therapies, we are not able to keep track of the patient remotely or even analyze the data we have collected. So it makes the treatment process to be even longer, which proves to be ineffective. So these three, among many other, are some of the missed opportunities that comes with paperwork medical data. So the solution that we are offering is building a cloud-based platform to securely store, manage, and share patient health records. So the records are scanned by individuals and submitted to a data entry personnel who inputs the data into the database, that is your account. And after verifying if the document that you have submitted is valid, so the platform is cloud-based, meaning that you can access the data from your mobile phone and also from your laptop, your desktop, or any other device. There is also an offline functionality for rural areas. I'm going to talk about that. The data entry is standardized, which means you can integrate it with the existing electronic health records. So you can go to your institution and ask for your data, and you can input it in this one account that has all of the data from all of the hospitals that you have been to, which is going to smoothen healthcare delivery for you as an individual in the future. So I will also want to emphasize one of the best solutions that you have, which is the ability to own your own data, the ability to, just like how you own your own physical paperwork, you can also own your digital data. But this time, it is even more useful to you. So with the ownership of medical data, a patient is more empowered to actively participate in their healthcare decisions. They also become more health literate, since you can better understand your condition and treatment options and progress. Also, there is the portability factor, where patients can freely share medical history with new doctors, with new specialists. They can move hospitals without delays. And another benefit of owning your own data is achieving personalized medicine. Personalized medicine can be achieved through tracking your own treatments, tracking symptoms, tracking response to treatments, to drugs, to therapies, and giving and being provided with personalized lifestyle recommendation. So the workflow of the platform, as I've said, is the medical documents are scanned and uploaded onto a database, and where it is analyzed into information. Let me use this one. So the documents are scanned and uploaded onto a database, where the data is analyzed into information that can be shared with the healthcare providers. The information is put in a way that is well understood by the patients, making them even more literate in terms of their own health. So you can access the information because it's a cloud-based. You can access it through mobile phones. And another key feature is that we have improved accessibility by enabling patients to carry health records on vacations, move to other countries without the inconvenience of language barriers. You can access your information in many ways. There is a software and a website where you can access your data, a mobile application, it can also be integrated and you can access it through your IoT wearables. So if you have maybe a smartwatch, if you have your own a smart ring, anything that you wear, it can be the tag can be printed on the wearables, and you can access your data wherever you are. So if you don't have a wearable, you can also access it using a smart card, that is an RFID card. You can also access it using USB security token, which means that you only have to plug it into a computer so that you can access the information. You can also access information through biometric authentication. That's a fingerprint or facial recognition. You can use a QR code, but that is in case of emergency. And also the best one yet is due to the increased security and decentralization, we can try and use blockchain-based digital health wallet, which is going to be more secure, and it's more decentralized than any other system. So I'm going to talk about the user. Yes. So the user of this platform is basically anyone who goes to a hospital, anyone who wants to keep track of maybe their appointments, anyone who wants to keep any information involving their health can use this platform. So the user is primarily the patient who is now responsible for the medical records. And us as a company, we are responsible for analyzing the data and presenting it in ways that a patient can understand, and also in a way that the healthcare providers can find more useful. So the patient will be owning their medical records and extending it to healthcare providers who can access the data and make informed decisions. The platform has very many applications. Among these is you can use it during emergency situation, where if a person is unconscious, you can still access their data using an RFID card, which they have carried, or there is a functionality where you can access someone's data using their phone, even if it's switched off, and many other applications, such as detecting patterns, like the likelihood of getting readmitted, disease prevention using personalized recommendations, and symptom trackings and medical condition monitoring in cases of even when you're pregnant, you can monitor your pregnancy. You can monitor maybe in cases of if you're diabetic or have a recurrent cancer, you can also monitor it through the platform. Basically, it is where you input all of your medical data, everything that has to deal with health, and you want to communicate with another person, you can keep it, store it electronically. You don't need paperwork, and which smoothens healthcare delivery in all areas, to be honest. So one feature that I've not talked about is the patient input. So the platform has different access levels. There is level 1, where the data entry personnel and doctors or certified medical personnel have access to. The data is uploaded as per the doctor's initial report, and it is not edited by the patient. So you can see it, but you cannot edit it. The second level is where the caregivers or certified caregivers can access and write notes on how the patient is doing, maybe during recovery or when they are monitoring the response to a certain treatment. The third level is where the patients can do symptom tracking. That is in cases where it is not too severe to be admitted, but it requires, in cases where it is not too severe to be like admitted in a hospital, but still requires continuous monitoring. Maybe in cases like maybe when you're pregnant, a patient can record their symptoms, maybe their weekly symptoms or a fortnight, and then they will get to discuss it with the doctor. Or the doctor can also access your data and see how you're doing. So there is, so that's this. Yes, I've talked about the key features of the platform and most of the benefits. That is the general view of this cloud-based platform that we clearly see it has a lot to offer in terms of smoothening the healthcare delivery in Kenya and in Africa. So I believe we are moving there, and we, as we continue with this, with more research and coming up with innovations on the same. So thank you for the opportunity and the opportunity that you're giving me to share something that I'm very passionate about, and I hope for success from it. Yeah, thank you, Glory.
Thank you, Jemima, for that powerful presentation. Thank you for sharing more about your project that is digitizing medical records to improve healthcare. So I will welcome Dr. Macharia, our CEO, to give further remarks about the topic. Dr. You're welcome.
Thank you, Glory. Please confirm you can hear me. Sorry.
Yes, we can hear you, Dr.
Oh, thank you so much, Jemima. That is very powerful. So, Jemima, a question for you. Have you started building this platform yet?
We are still on the prototype. We haven't started building it yet.
Okay.
Yeah.
We need it. It's highly needed because all these people who are creating, electronic health record in Kenya.
Yes.
The idea of electronic health record is fragmented. It's patchwork. It's not comprehensive like what you have described here. For you, you have described the totality of it all, ranging from the patient through to the provider, to the payer, and then of course the payer people have to pay, and then even collecting the health data for public health, epidemiology, for government. That is what you call turnkey. Turnkey is where it's all in one, it's complete project, and that is commendable.
Thank you.
There is one technology only that is able to do all those things. Why previously people were doing it is fragmented because technology was not there. The technology for that work is called blockchain. Everything you have said is what blockchain is built to do. All of it, including identification. Now, QR code is sufficient. We don't have to worry about going back to the RFIDs, that's radio frequency identification, because that was the previous generation ID type of system. So QR code can handle all that information, but you would need to have a blockchain address. For example, what we usually call a wallet address. So your project is comprehensive in the following ways. It accommodates the 6 stakeholders for health. who you're calling the users. The users is not just the patient. The patient is the primary user, of course, because, and you see, when you're talking about, people are talking about electronic health records today, they don't have a portal for patients. What they usually do, they create a health record for just the doctors to use to enter health data or medical data. But then you ask, can the patient access this at home? No, patients can never access the existing electronic health records in Kenya or even in many other parts of the world. So first of all, congratulations for that. You are starting with the primary user in mind, who is called the patient. And before a patient is a patient, is a healthy human being. That means that you don't have any disease, but you need to have access to that portal so that you can start interacting with the health system. That's the power of this whole thing. That your let's say the power of your platform, that people who are not sick yet can interact with the health system. Remember, we are talking about health system, not a sick people system. It's a system for maintaining you healthy so that you don't come to the hospital. Okay, so the first thing is to find you where you are as a healthy person. So if you have a platform that can do that, that is a big check. So the second user is a provider. And these providers begin with the community health promoters. The community health promoters are the people who work from house to house, visiting mothers or visiting families, teaching them about good nutrition, and they would have access to your platform, just like the patients as users. And they would have discussion with, say, for example, if you have a visiting health provider coming to see a woman before she gets pregnant, they can talk about prenatal care, or even after giving birth, they can talk about postnatal care at home. These are home visits. So this system that you're talking about is available to such people because it's going to be available on the cell phone. So number 3 of the users include now the other providers. You could say the ones that are in the hospital, like physicians, nurses, surgeons, and you want them to enter their data directly into the platform. When they're taking the patient history, that is known as the patient encounter information, and that is recorded all there. And something else you want to add that is how this platform communicates with the laboratory for clinical labs, for example, for the blood biochemistry into the pathology lab, and also for the imaging system, so that when patients go for x-rays, the x-ray is loaded straight away by the people in the imaging department. They don't have to carry a whole packet of images to bring to the doctor, but the doctor can access it directly on the platform. And also for, say, hemogram, could say the blood counts, could say the white blood cells, the red blood cells, then the blood chemistry, they can see directly on the platform because it's connected to the lab. That is known as a clinical lab information system. So you want to get that integrated as well. And then the other users are the pharmacists. Now, after the patient has seen the doctor, they get a prescription. So if that prescription is entered right into the system, and as the doctor finishes, this is my diagnosis, you go and take these tablets, then he writes there, then he double clicks and this appears at the pharmacy. So all the patient needs to do is walk to the pharmacy and is going to find the prescription there. That is called pharmacy order entry system. So you want also to add it there. And then after the pharmacy has received that, then there's a payment system. Because I think payment comes even before you begin talking to the doctors. Because before you enter a hospital, before they agree to admit you to the hospital, they have to verify that your ability to pay. Yeah, this means the system has to interact with the payment providers, whether they're in the insurance company, or as we are talking now, blockchain payments, like with Actuate tokens in the future. So this means that this platform is going to collaborate even with the payment itself. And I think if we work together, we are going to figure out how that is going to work. As we're talking about building smart contracts, health risk pooling for making sure there's money available for you when you go to see a clinical provider. All you have to do is flash your QR code. QR code is sufficient, and the QR code is going to have all that information. Now, so this information then, because that QR code manages that, then you can have aggregate data that can be used by the government for predicting following the let's share the call. She doesn't know we are meeting. Okay, I'm going to call her later. So we are talking about the government gets information to track the distribution of health, first of all, distribution of diseases, or even the emergence of new diseases like index cases. If there's an index case, meaning an index case is a new infection that has occurred, getting reported the first time, is going to be reportable. You can see it on the data. And then the blockchain is the best technology for doing all these things, because blockchain, first of all, is very powerful. It's able to bring all those data points together and display it using just one QR code, which is on the blockchain. And then, of course, blockchain is immutable, that somebody cannot come and change that data. But still, blockchain is boundaryless. That's what they're talking about, portability. That you can access that information anywhere you are in the world, on condition that you've got a cell phone. So the cell phone is the primary technology for the health access. Okay. So the cell phone is the primary technology that will take you to all these different places. Instead of now having to go to the hospital to find your documents or to find your files, the files find you through your cell phone. So what I would say is that if you're building this platform, first of all, is that Web 2 has taken us so far. And I think the ultimate answer to the platform that you're creating is the word own. Patient owns the data. Ownership of data is the hallmark for Web 3 technology, which is called the blockchain tech. Web 3 is the own web. Remember, we have 3 webs, or 3 stages of development of the web. There was the write web, which was you could only write. But then if you could write the read web, there was the read web. So the read web, you could only read what was written by a few people, like a newspaper. That was 1990s. Then we came and got the write web, the dynamic web, which gave us Web 2. Technologies like Facebook, WhatsApp, LinkedIn, Twitter. And then we have the own web technology where you own your data, and that's what we are talking about. So own web is what's called the blockchain technology. And that technology is the technology for the ultimate access, because it's decentralized ownership. And I think that's what's most powerful about what you're describing. And I would, we would like to support this very, very much, build it. But of course, you want to build it on the blockchain like Solidity, so that it can get into the blockchain, which comes with all the security, immutability, privacy. A blockchain is able to do all those things. So we are talking about the electronic health record on the blockchain. So now the distinction, the blockchain is distinctly different from cloud. Cloud was, say, like a company like Google, making servers in one location. So clouds are centralized because you have either Google or AWS, that's Amazon Web Service, or similar, or even Facebook, they have their own cloud. They have data centers. These data centers are a big building with a lot of servers and a lot of cooling. Blockchain is different. You don't have one building with a lot of servers. This data is in the internet. And the thing is that where does the space come from? Space is located in so many people, different devices all over the world. It's distributed, right? That's why it's decentralized. So I think the word is distributed. Although even when the word cloud still makes sense, even if it's not the centralized clouds like what you had with Google data warehouses. So what I'm saying is that if you now come to the blockchain, we don't have to buy huge data warehouses or build big data centers, because that would be a serious limiting factor for emerging economies that people don't have money to put down big data centers, which cost about $100 million. Okay, so a data center is very expensive to build because this is a lot of data. And where is it going to be stored? If it's stored on the blockchain, we don't have to worry about the large data centers or expensive data centers. That is what makes blockchain economy extremely applicable to this. Now, the main challenge then you get in the health system is during the implementation, resistance from the providers like physicians, refusing to use it because they can say, if I read something on paper, I don't then want to type it again. How are you going to convince them to type? I think that's a secondary problem. And then what is already in physical formats, like paper, medical records that are on paper, and medical records that are in image, films, photographic films, whether they're X-rays or CT scans. It would mean scanning them again, and you still also need to buy devices for scanning, and of course employ a lot of people to scan. So I would say that that is, first of all, that's very expensive, and you find a lot of resistance asking, because you would have to get the people in medical records scanning people's documents that are already existing. I think the way forward is to move forward from there. Say we don't want to go back, because in a space of let's say 5 years, those medical records that are old, you shall not need them anymore. They are going to be washed out naturally out of the system. Is that we introduce something new, and that's the new standard of working, and we make sure that every new patient who comes in gets entered into the system directly from the beginning. It's called double right from the beginning. But scanning paper is something that's going to face some serious resistance, as we have seen in so many other places where people are saying, now you have to come and scan all the documents so that we can save it. And people say that's a lot of work. Who's going to pay for all that? They complain, and then eventually the whole thing collapses. But if you say, let us just go online, and from here, we don't want to see any paper anywhere. So I think we will have to create a policy for paperless. Let's go paperless 100%. Anybody who buys a printer is punished. Maybe that printer is returned to the shop. Unarudishia mwenye duka we don't want this thing. It's going to waste a lot of our energy printing. We don't print. Yeah, it's to refuse to print. So it has to come up with a policy. I think where we have to work with the Ministry of Health. No more paper, no more printing. Let's get out of paper right now. And then we say anybody who buys a paper is going to be fined, because printing on a paper is killing a whole tree. Okay, so he has to pay for all the trees that he has massacred. Well, this guy, those are the additional comments I would like to add. But so think about blockchain. Now let me ask you, Jamima, have you worked with the blockchain somewhat?
I haven't really, honestly, I haven't worked with blockchain. When I heard about this event, I went to research about it, and I've learned a lot. And that's what even my project needed, because the things that you have highlighted are true, like they are the things that are hindering it from being actualized. But blockchain technology is the solution. I haven't worked with it, but I'm looking forward to.
So blockchain is a solution. And then you see, you want to know you are not alone. There's a lot of people now. Some are here already. Others are not here yet, but you're going to meet a lot of people at the summit, because we're asking how do we use blockchain technology and decentralized finance for this type of work? That's the question. How do we use the blockchain technology? And so there's a lot of people. For example, there's a Web3 community that is in Nairobi, and we want to appreciate all those people. They are very young people, the Gen Zs who are working on the blockchain projects. The thing is that blockchain has not been mainstreamed in academia. So if you look for it in the university curriculum, you're not going to find it. That's the disaster about the academia will come later on, like 25 years later, say, oops, oh yeah, we are not on blockchain yet. 25 years later, that's a quarter century. So don't wait for the academia to come 25 years later. Get on board with blockchain right now, because blockchain is the technology of the age. And besides, so you don't want to work alone. And that's why this is important, that you find the connection, people who understand blockchain, and they are going to explain to you. And then we can start working on those platforms, the platform itself, particularly the platform that's going to capture those 6 users. So it's not one user, you're talking about 6 users, and then how they correspond with one another. And those are the 6 users who, you could say, the source of the health data that we need to make clinical decisions. So we say number 1 is the patient who is already healthy at home. Number 2 is that community health promoter. Number 3 is the provider, who are the nurses, doctors, surgeons. Number 4 is the pharmacy. Number 5 is the laboratory and the imaging people. Number 6 is the pharmacy. I think there are 7. The 7th one is the government, we say, for public health. Okay, so you want to make sure that it has features that accommodate all those users together. And of course, each one of those users has got different access, different levels of access or permissions to enter data. Okay, yeah.
Okay.
The blockchain is able to do that. So a patient can access the system to provide health information about herself, like what you're saying. If she has symptoms, she can enter them there. But then that patient cannot edit what the doctor has entered. The doctor has entered the information, but the doctor cannot edit what patient has entered. See? And then people at the laboratory can enter the information, and the doctor can see. The doctor cannot edit what people in the lab has entered. So these are differential permissions. And then, of course, you have the pharmacy can receive a prescription. Nobody can change that prescription, because you can imagine if the doctor prescribed 10 mLs of insulin, yeah, or 1 ml of insulin, and then somebody gives you 110 or changes it to 110, that is going to knock you out. You'll be found in a coma, because the pharmacy is going to give you 110 mLs of insulin. Oh yeah, so it becomes immutable that nobody can change. It can change in the middle, and so this is why people have to have different permissions. And see, when somebody enters a prescription, like 10 mLs, 10 milliliters of a drug, the dosage, it has a timestamp and the name of that person, which is corresponding to the QR code for that person. So that's what's called, that anyone can know. If we come later to check who prescribed that drug, we can actually know who prescribed it, and whether, but nobody can change it. So there are 7 users, you see, and that's, so you want to make a team of people, and what you're going to do is help you gather together a bunch of people to form a team that can produce that health record. Then by the time of the summit, you'll be able to present it to the people. Okay?
Okay.
Yeah, excellent. Jemima.
Okay,
All right,
thank you.
back
Thank you
to
for
you.
your insights. And thank you very much for your insight. Yeah, I'm going to continue working on it by the and get a larger team. Yeah, and I also need a team and mentors and people who actually know how to create it, and yeah, the technical skills to create it. Thank you very much, Dr.
Yeah, so you need to, I think you need to separate kind of people. Maybe a set of mentors, which in the mentors is you already know that science, what you intend to achieve,
Mhm.
and then you want and with that only can help you to find out what you need to build. So is a platform that can accommodate those 7 users. Okay. And
Okay.
then you need a blockchain team, people who can build those those functions usually because of blockchain. And then we can figure out how it's going to work. Okay. And
Okay.
then ultimately, blockchain, the ultimate ownership is money. It's figuring out, and of course, it would mean that there will be a token that's managing that whole system. Let's talk
Mhm.
about that. Come up with a list of names. Then by the time of the summit, now you'll be presenting, you're saying, oh, this is the team. What are you going to call that team? Health access team? Yeah, you come up with a name, all right?
Yes.
Yeah, awesome. Because it begins with a name, and that name
Mhm.
describes the work you're going to do. Mhm. Okay, so back to you, Glory.
Thank you, Doc, and thank you, Jemima, for that powerful presentation. Thank you for the amazing work you're doing, the amazing prototype of your project. We wish you the very best. And yeah, you're bringing the future we want in healthcare very, yeah, you're bringing it closely. We wish you the very, very best. And once again, we appreciate you. We appreciate you for presenting your work to us. Yeah, we have really learned. It's amazing. It's insightful. Thank you once again, and we we welcome you to our summit. It will take place, as I had said, at Kenyatta University from that to 6th of December, main campus. And we would like to welcome you as a poster presenter. Yeah, come present your project to our audience, and we strongly believe that it will bear fruits. Once again, I wish you the very best. So, in case you have any questions, you can type them on the chat box. Yeah. On another note, as I said, we have a summit at KU, and the summit is really gaining popularity. A lot of people, a lot of organizations are gaining interest in our summit. We have secured a number of partners. We have like even the biomedical, we talked to Dr. Iloka, biomedical engineering department. Also Shandaria Innovation Startups under Shandaria Innovation Center, KU, will also be coming. The KU IPTCC. We have other partners like University of Nairobi, C4D Lab. We have like people like GE, Naivas. We have KUTRH doctors. We have Nuclear Society of Kenya and many other partners on board, and also attendees. we still have exhibition spaces and sponsorship. So if you are there, you want to exhibit your product, or you know a person who wants to exhibit their products in our summit, we still have that space. It has not yet filled up. So yeah, you can come. And also has poster presenters. We are also welcoming them all. Yeah. So especially the health access. The health access we have a health access workshop that will be led by GE and other stakeholders. Yeah. So this summit it's a multidisciplinary summit. It's bringing together like stakeholders from different sectors, from health, from technology, businesses, to facilitate idea sharing. So you can imagine the different experts that we will have in the summit. So you don't have to miss. Also, the registration of attendees is still ongoing. So kindly let's prepare well. Let's prepare to come to the summit. Daktari, do you have maybe something to add about the summit?
Oh, yes. Okay. Hold on. I'm not sure whether I turned this off. Can you hear me, Glory?
Yes, Doctor, you can hear
Okay.
you.
Yeah, sometimes I press off the summit. It's big deal, because as Glory has said, that the response to the summit is very high. People are so interested. It's amazing. Every day, almost day, I get about 5 different phone calls from people telling me how they want to come, and very excited about what is happening. So we have workshops, about 5. There's 7 workshops. Even today, I was talking to the registrar at KU. They also very excited, and he was telling me, "Oh, our amphitheater can handle 3,000 people. So call everybody." Yeah, 3,000. So if we go there with less than 3,000, we know that we are not doing favor. We are not actually doing, most of the amphitheater will be open if we have less than 3, because they can handle 3,000. Then we said we have so many breakout rooms, and right now we have booked 7 of them. These breakout rooms are where we're going to have the workshops. So the amphitheater is very, very ready and good to go. And it has all the technology, audiovisual technology. So what you're saying will be recorded, and it will be audible very clearly to everyone, because they have very good audio-visual equipment. Of course, visual means that it will be easy to see for all of you. So come with your presentations. And you see, when we want to have, by the time we are coming to the summit, because all these people are calling, they're asking, how do I present my work? So we are going through, it's like a design process. The summit is a design summit. So you're coming there to complete the design of your work. So for example, the way we have talked about electronic health record today, is not just a health record for the doctors. Is the design to see how do you include all the users. And we want to have this conversation as early as possible, so that by the time of the summit, you know exactly what to get out of the summit. Because the summit is for you to find partners. There are 3 types of partners that you want to find at summit. Partner number 1 are technical partners who can help you execute the project. That, first of all, before even executing, refine the project that you have in mind. For example, you have now seen Jemima has got a project she has in mind. She has that project in her consciousness. That's what she wants to build. Okay, and she's told us So don't forget that, Jemima, you have told us that you are right there. That is the things hoped for. That substance or that thing hoped for, that what you hope to achieve is how we can have an integrated health record that is able to follow the health of a human being. It's not about patients, it's about a human being. So when you start from there, then you will have partners who can help you to clarify the vision. The vision usually is not clear because you cannot see it all the way by yourself. So you want to be in that summit to help you to clarify that vision, to sharpen it. So they become that sharp like a sword. Okay. And then when it is sharp, the vision is sharp. Then you need an assembly of technical experts, people who can help you do it. And you see, there are different people have got different type of technical skills. There are those guys who can build the blockchain. There are those guys in computer science in general. And then there are other people who know biomedicine, they know healthcare, they know health access, they know health policy. And they are all going to be there. We don't want you to come out of that summit without having made such profound connection. That is why we say the summit is the venue for profound networking. 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 That means it's building a network. So you find partners of meaning. So the partnerships of meaning. Meaning what? Meaning how to execute your vision. Mm-hmm. How to bring that vision the vision of the future to the present. Okay, that is the goal. But it's a third thing, that thing that people never talk about. That thing is called money. Money. How do you finance all that? That's what's called capital formation. So if we come out of that workshop, we come out of this summit without you having figured out how to fund your project, you know that you have failed in one major important goal. You didn't get it. In fact, if you miss that one important goal, you have missed everything. So listen carefully. You want to come and listen and learn how to create money, or how to form money, or how to form capital to fund your vision. Okay. If you come out without that, then you know that the summit was of no use to you. It's totally useless. As you know, it's all or nothing. Either you get all the points, the 3 points, you get the team to help you sharpen the vision, you get the technical team to help you implement the technology, and then you get the team to help you form capital, and then you understand how to form capital. That's what's about. Because as we say now, for example, this electronic health record, it might look like a very easy thing to say, but let me tell you, when you go to implement them, you have to convince people who are called users. You have to convince the community health workers to actually enter that data. How can you convince them without paying them? This means that you have to pay them because they're employed, they have to earn money. Where does that money come from? See? That money, first of all, maybe even we are talking about community health, but they do not exist. It means there are people you would have to hire to do that work, to roll out that health record or integrated health record all the way down to the village. There are no such people in the village. It doesn't mean there are no people living in the village. They're actually there, but you need to pay them as employees. So in order to pay for them as employee, you need to know how to raise the money to pay them. That's what's called capital formation. So the third checkbox, you have to make sure it check is a capital formation. So how many checks do you have? 3 checks. Check number 1, the team for helping sharpen the vision, so the vision become sharpened. Check. Then check number 2, let's say checkbox number 2 is the technical team to help you implement the project. That technical team is a multidisciplinary technical team. It's not just one friend there. You want people who can actually make things happen. And then the summit, you're going to help you identify those people. Check number 2 checked. Check number 3, you need to know how to form capital to implement that. Check number 3. Now, if you have check number 2 and check number 1 and check number 2, but you don't have check number 3, that is equals to 0 check, because it is all or nothing. That's how it works in life. Principles, it's called a principle of all or nothing, that you cannot do some things and do some others and hope that you have done something. So that's what the summit is about. And so our job is at Actuate Foundation is to make sure to help you to check number 1, check number 2, check number 3, check. Then you can check out. See, that's what it's about. So it's all about you in learning how to create a future that you truly want, bringing that future to the present, bringing people around you to help you do that, so that you know that you're not alone, that you're surrounded by people who can help you complete those 3 checks. Check 1, check 2, check 3. And so between now and December, you want to keep thinking about those things. How do you think about them? By asking questions, interacting with the team here, asking questions, and so that if you there's some of these things ideas, but you do not have a clue who could help you in certain area, and then what will happen if you have some things that you don't know who can help you? Now it's our job. We can help you invite such people. Just tell us. And then there are some people you know who can help you, but you're not in direct communication with them. Invite them to the summit. Let them show up there so you meet there in December. Because it is not very easy to approach everybody directly, because some people might think you're bugging them. But if you're inviting them to a meeting, that is a third thing out there. It's a summit. So let's meet in Nairobi at the summit and talk about these things. Then that becomes a neutral ground. They're not committing to you. The people are not committing to you. They are committing to come to the summit. But then you know that they are coming there so that you can complete those 3 checks. Check number 1, check 2, check 3. So if you think of people who can be your advisors to sharpen your vision, people who can work with you in technology, people who can help you in capital formation, invite them to the summit. Without telling them, I'm inviting you to the summit so you can come and invest in my idea. But you know, that is what you are thinking. You want them to come and invest in your idea during your capital formation, but it's between now and December, you want to have prepared the funding documents. Because each one of those 3 things requires certain documentation. For example, if you want people to be advisors, to help you to sharpen your idea, you need to create a document, kind of a summary document, a brief. This thing is called a brief. Brief presentation of your vision. And you say, I need some mentorship in this vision. Then number 2 is a brief of about the people who can come here help you with the technology. For example, people in blockchain, you want to invite them to participate in your blockchain projects, your blockchain project, and people in, say, biochemistry, in biology, in, whatever people you can think of. You want they come in and form a team. And then there are people who are called investors who would buy into your idea. Now, the question is, how do they buy into that? How do they put money onto your project? That is usually the hardest question. Ladies and gentlemen, if on the blockchain, that question is not very hard. It's probably the easiest question, because the blockchain is built for that purpose. You can raise money. So for example, if you want to raise money with this for electronic health record, you can issue a token. Token for what you are doing. And so this, I'm telling you this, Jemima, so you know, you issue token, and then we can figure out how people can buy that token to fund your project, and then we see how we can allocate actual token against your token. Because when you have a token, now you have the bargaining power that we can now use the actual token to work with your token. So it becomes token to token. See that? So let's talk about these things. And so this is for everyone who is here, that the token itself, is if you're building that thing on the blockchain, ultimately it's going to issue a token. And that token, all we have to do with the Actuate token, Actuate is a foundation. That's why it's Actuate Foundation, has a foundation token that now will interact with your token so that you can raise money to create the product that you want. Okay? Does that make sense? So that is the secret or the mystery. If you don't have those things checked out, check one, check two, check three, then you know that you're missing one whole check, and eventually the project is not doable. The doability of the project itself is called doability, which in English language called feasibility. Feasibility, feasible is the French word which means faisable. Faisable to faire is French, means to do. So feasibility means doability. Okay? So the feasibility of the project does not rely on what we are allowed to call economic feasibility studies. That is complete nonsense. Feasibility is a function of financial innovation. You innovate the money, that means you create a token, then you are able to do any kind of innovation you want. There is no innovation without financial innovation. According to Markowitz, 1952. Who read Markowitz? He said that financial innovation is an absolute requirement for any innovation to happen. That's Markowitz, 1952. So there is no innovation without financial innovation, ladies and gentlemen. And that is why that checkbox for financial innovation, checkbox, it has to check before you leave the summit. And we want to make sure of that you have understood that you're not coming out of that summit without understanding financial innovation, because without financial innovation, there is no innovation. Then the financial innovation is the token itself to fund your projects. And it's best that you issue your own token, which now we can use to tie with Actuate token, and we will help you with that process. Because when you do that, your token tied with Actuate token, we're going to put them in the liquidity pools, and when we create something called liquidity, so your token becomes liquid. Okay? And you say, why is this thing hidden to us? It's not hidden, it's there in plain sight. So everyone to understand blockchain and make sure that by the end of the summit, we have full comprehension of what that is all about. Okay, so thank you, Glory. Back to you.
Thank you, Doc. And thank you to our topic master, Jemima. And thank you, everyone, for attending. It's been a quite informative session. Yeah, I hope everyone has learned a lot. Yeah, so unless there's something else, we are heading to the end of the meeting. I have shared the attendance form so that make sure you fill so that you receive the tokens. We incentivize our learning so that you receive the Actuate tokens. It's a sign of it's the beginning now of building the future we want by accumulating the Actuate tokens. So make sure you fill them, and I hope to see you again next Thursday. It will be interesting also as today. So unless there's anything else, we can adjourn the meeting. So I will give you a few minutes. Okay.
Bye, everyone.
Okay, bye. Bye, Daktari. Bye, everyone.